Thank you. This is literally my Roman empire. Every time I have a girlfriend, someone I know that wants to have kids, or a couple, this is all I can think about. I just wish it was way more common for people to get just regular, like you do an annual checkup. I wish it was just a thing that to do a regular checkup for your fertility if you're planning to ever have kids. People always make it so easy to get pregnant and all of this, but we all know there's so many different factors that can make it hard. A male problem, a female problem, unexplained infertility, endometriosis, PCOS, tube block, varicocele, karyotype, being premenopause, diminished ovarian reserve. There's so many different factors. Or simply just be a carrier of a gene like spina bifida, cystic fibrosis, and not wanting to have a kid with it, so doing IVF is the only solution. But no one knows what's going inside their own body. Everyone doing IVF, or at least 95%, never plan on doing IVF. No one plan on doing fertility treatment. 50% of the time it's a male issue, and I wish women will stop blaming themselves, or OB will stop blaming the woman for whatever reason, infertility or miscarriage, when 50% of the case it's a male infertility issue, no sperm, varicocele, whatever the reason. But if they already knew that it was a male issue, they wouldn't be wasting so much time and blaming themselves. And then if we did blood work and work with AMH, FSH for the fertility, not just like the basic one, like the actual, like a little deeper for fertility, and also like ultrasound to check for PCOS and all of this, women will know in advance and not lose time when it's time to when they actually want to try to conceive. You know the number of women that I've seen that are 20, 22, 23 that had diminished ovarian reserve, that are literally in their 20s. So luckily they get married, and then that's how they find out, because they're trying to conceive. But if like me, you're waiting until you're 30, 35, it's way too late, and then you're in premenopause. So I wish those women will know in advance, because if you know in advance that you have diminished ovarian reserve, you have PCOS, you have endometriosis, whatever you issue, or male issue, then you can do whatever necessary, like freeze your eggs, do treatment, so in advance, and stop wasting time. And don't even get me started on the women that wait until they're 40 to get pregnant. I get it. You're trying to find the right partner in whatever life, your career, but you should always check your fertility status before it's too late. There's two companies online that I know to get for female. The one that I did was Let's Get Checked, and the second one that I know is Modern Fertility Hormones. I think even LabCorp has a fertility panel, but the thing important is to check for AMH, FSH, LH, all of those hormones that are very, very important to know your ovarian reserve and your fertility status. The semen analysis can be done from companies, but also can be done, I think, like a real semen analysis from a fertility clinic, or like some center where you can get your sperm tested is better than the one that you find online. But yes, I wish it was way more common for everyone to do this as a regular checkup when you're in your 20s, to know what kind of issue you're going to have or not, what kind of carrier you are for which gene, so you don't marry the person that has the exact same gene as you, so then you have chance of having a kid with that disease, so you know in advance and you can prevent it by doing IVF. There's a lot of things that I wish people will do so much earlier, or that will be like just normal to do by your OB or your primary care doctor. It's just not common, and people waste so much time because of it, and it's literally my Roman empire.